ultrasound or CT, steroids or antibiotics. Imaging and treatment for neck infections can vary widely. At the 2013 Advanced Pediatric Emergency Medicine Assembly, Dr. Keith Borg said these infections are getting more complicated, and emergency physicians have to be prepared.
Infections are on the rise. We're seeing more and more of them. We're seeing more complicated head and neck infections. We're seeing a reemergence of diseases like Lemierre's. We're seeing some of the older diseases like diphtheria and epiglottitis come back in some populations, like those travelers or unvaccinated. So just being aware, careful identification, and early and aggressive treatment is very important. Certainly in HENT infections, the biggest thing you want to look for is how sick is the patient, is their airway stable, do they need immediate resuscitation, do you have to address the airway in that recently, or can you proceed down a further diagnostic pathway to figure out what's going on? Certainly your ENT colleagues are going to be great help to you in these cases. The sicker the patient, the earlier I would get them involved. The more well the patient, you may just be setting up follow-up with them. But good phone conversation, knowing those providers and what they like and what they don't like and when they like to be called, having those conversations offline and sort of planning that referral pattern can be very helpful too. Certainly in older kids with either parapharyngeal or more neck infections, not retropharyngeal, or kids that are compliant, ultrasound for peritonsillar abscesses is a great choice. The younger the child, the more likely I probably am to use CT, which is sort of ironic because they have a higher risk of radiation, but it's going to be much more difficult to image them via other routes. There's a lot of different potential treatments depending on where the infection is. Broad spectrum antibiotics, knowing what types of infection you're going to be dealing with depending on the source, is certainly a mainstay. Whether you're going to give those IV or PO will depend on how sick the patient is, whether they're going to come in the hospital or not. Steroids are really helpful in PTA based on one small study, probably not helpful in a lot of pharyngitis, but are certainly used widely. It's something certainly to discuss with your local providers. How you're going to, whether or not these patients are very sick or not, will lead you down the road of whether you can admit them with close observation, whether you can have them return for close follow-up, or even just follow up with their primary care doctor if it's something mild, because it's really a spectrum of illness that you'll see.
Dr. Borg added that pediatricians should work with radiologists to ensure appropriate dosaging for their patients.
There's a standard principle called ALARA, A-L-A-R-A, which is use the lowest possible dose for a smaller patient, a pediatric patient. And so you really need to talk to your radiology department and make sure they're using appropriate level of radiation imaging in pediatric patients. A lot of academic centers do this, some community centers do and some don't. It's a quick and easy question to ask, and you can significantly decrease the dosage.
From Orlando, Florida, this is Frances Correa.